MGH Chelsea, we are really fortunate to have a team of community health workers. The team comes from 25 different countries and actually speaks 21 different languages.
Community health workers are the bridge between patients and the providers. We help build relationships and also help to bring the patients' voices forward when we are a part of the care team.
So sometimes it's the social determinants of health. You know, where is a patient living? Where are they working? What are they struggling with around food, housing, education? So we had a patient that was not taking his medication for diabetes, and the care team couldn't understand really what was going on because the patient seemed to understand how to take their medicine and that it was important to take their medicine. And it was the community health worker who was able to unpack the fact that in the place where the patient worked, the employer had a no injection policy. And so it was working with the employer to say, this patient needs to be able to take their insulin. Where's a safe place that they can keep their insulin so that they can take it in the day?
Studies have shown healthcare only constitutes a small slice of the pie in the overall health of a person. For a large number of our vulnerable patients, navigating the healthcare system on their own could be a big ask. We currently are offering services around housing, access to public benefits, immigration, advocacy within the Chelsea school system, naturalization, and more. And we have our own food pantry here inside in the health center, where we screen primarily for food insecurity for our vulnerable and undocumented patients.
Chelsea has always been a gateway for refugee and immigrant families. Many of those families have experienced traumatic events in their countries of origin or during their journeys here. Many have come to this country to escape war and violence, as have many of us who work here as community health workers. Upon their arrival, patients often do not speak English and have no social connections to the community, which make them isolated and depressed, and their children are impacted.
As community health workers, we are not only guiding and coaching patients, but also empowering them and helping them build the necessary skills and the confidence to become their own advocates going forward.
Hopefully by meeting patients where they are, addressing social determinants of health, and really reducing the barriers to healthcare, then we're contributing to health equity, and that's our goal.